Good afternoon, Dr. Roberts and Pierce. Today, I'd like to talk about critiquing an article um, that is titled A Phenomenological Study of the Lived Experience of Nurses in the Battle of COVID-19. Um, and the authors are Gunawan et al. The study was done in 2021. And the reason that I chose this article is because um, this is in line with what I wanted to do my qualitative pilot project in. I'm interested and I'm wanting to understand how my fellow nurses, um, what their lived experiences are as they provide care for patients in the hospital during the pandemic. So that's why I chose this article. Before I get started in evaluating the article, I'd like to share some images that have become all too familiar to us that nowadays we see in media, the newspaper, and the internet. And the image in the middle shows nurses, doctors, healthcare workers taking care of a patient that's critically ill with COVID. And the other images that you see on the outside, the other four, just illustrates the frustration, the stress, um, perhaps burnout that our colleagues, especially in the hospital, are experiencing. So that's why, and for my pilot project, I wanted to explore and identify a phenomena with regards to these nurses who are caring for patients with COVID. What are they? How is caring for patients with COVID working during this pandemic affecting their physical, psychological, emotional aspect? How is it affecting their personal life? There are quite a few questions that I have that I wanted to explore, and this article that I'm gonna evaluate uh, gives me some idea of what um, um, other nurses are experiencing through their lived experience. In this study, the researchers wanted to explore the lived experiences of nurses and combating COVID-19 in Belitung, Indonesia. Belitung is a small province in Indonesia that is considered a red zone at the time that they did the study, meaning there was an increased number of infections and death. The authors researchers also wanted to provide crucial information needed to optimally support nurses and to also recognize their heroic efforts during the pandemic. So the inclusion criteria for the participants are that they are registered nurses who provided direct patient care to patients who had COVID-19, and this study was done in a hospital in Belitung, which is again a province in Indonesia. Um, and in Indonesia, nurses are usually quarantined after their shift. They are assigned to a room to stay, um, and they cannot go home and be with their family. And that is to prevent um, like the infection from spreading to their family and their community. So at the time of the study, there were 31 nurses who were currently um, in providing care, but out of those, 17 nurses were chosen, and 12 were females, 5 were males. The nurses were usually um, separated into 3 different rooms: room A, B, and C. And for the study, they used purposive sampling, choosing 5 nurses in room A, 7 nurses in B, and 5 in room C. The average age is 34 years old. The study was conducted in the span of 3 months from March to June 2020, but prior to that, ethical approval and study permission was obtained from the hospitals. Interviews were usually conducted online, lasting 30 to 60 minutes, and they were recorded and transcribed verbatim. Because at the time it wasn't possible to um, to have face-to-face interview because a lot of the times the nurses were too preoccupied during their shift. So you know, and also they wanted to minimize the spread of and the infection. So that's why they conducted it online. The researchers also provided a paper format, some of the interview questions in paper format, and they expected the participants to return those in a week. In the article, the researchers included some of the interview questions that they asked the participants. For example, they asked the nurses, could you please tell us how you feel today? Do you feel afraid, worried, stressed, and depressed in caring for patients with COVID-19? Why? Could you describe how you deal with your life as a nurse taking care of patients with COVID-19 every day? How many hours of your shift? Do you think it is harmful to your health? Why? Does this hospital support what you need? Could you tell us about the guidelines, facilities, and personal protective equipment? Could you tell us how do you feel about staying in quarantine and unable to go back home? They also asked the nurses how people react towards them and knowing that they are nurses and they work in the hospital. How did the participants feel? And they're asking how, to describe their feeling, their emotions. After gathering data through the interviews, um, the data was analyzed using Van Manen's approach, which are 6 steps. Okay, and it's listed here. One of them is framing the lived experiences of nurses into the research question, and that is, what is the lived experience of nurses in the battle of COVID-19? Investigating the experiences of participants through semi-structured interviews and chats, developing themes from the interviews, describing the phenomena and writing about it, aligning the phenomena with the themes in the research question, and merging various thematic statements into cohesive themes. And finally, after collecting data and analyzing it, the researchers identified 7 themes that emerged from the study. The first one, that is, the participants reported that feeling of nano, and in Indonesia, that's a phrase for having mixed feelings. So the nurses had indicated that they were scared, fearful, stressed, and they had a hard time describing their feeling. The participants also said that they were frustrated because the lack of the N95 mask, and oftentimes they have to reuse their masks. They also felt that there were just pawns and that were used in the hospital. They were told what to do, to care for patients. They were told to quarantine, and then they couldn't be with their family. So they were, feeling frustrated. Another theme that came up was that feeling of being rejected, and that is there's a stigma attached to, you know, um, um, having the COVID, and there's a lot of fear in the community. So they're afraid that the nurses would bring disease and spread it to, to the community, which ties to theme number 5 of the participants not wanting to spread their identity because again, you know, that because of the stigma and fear that they'll be shunned by the community. And because they were quarantined during their shift assignment, they felt, they felt lonely. They missed their home. They had that longing to be with their family and to go home. And they also had that feeling of feeling betrayed by regulation because apparently the guidelines in terms of social distancing, wearing masks was not being strictly enforced and followed by some of the citizens. So these are some of the themes that emerged from the study. So overall, I felt that the researchers did a good job in um, conducting the study and writing about it, and that they were able to capture how these Indonesian nurses, felt or what their lived experiences were while caring for patients during the pandemic. The researchers had included some of the statements that the participants gave about how they felt or what their thoughts were on some of the interview questions. They did include them in the study, and I appreciated that. Um, they also gave a brief background of the impact of COVID-19 in healthcare worldwide. That was done in the beginning of the paper, while also giving a brief description of what healthcare is in Indonesia, which is decentralized. It used to be the responsible of the government to provide care, but over the years that shifted to local communities. I did notice that in the study, in the article, I did not find any literature review, so that was lacking, and there was no theoretical framework that was identified. The authors, however, did a good job of explaining why they used the phenomenological design for the study, which is apropos for this kind of research. However, for this kind of design, for the phenomenological design, typically researchers would disclose bracketing, which is what how they what their experiences with the phenomena and how they separate themselves from that, so that it doesn't influence the participants' experience of the phenomena, or doesn't affect it. Um, Also, data collection did involve interviewing 17 nurses in the span of 3 months at a provincial hospital in Indonesia, and that data was systematically analyzed following Van Manen six steps. Um, and towards the end, they did identify those 7 themes that I went over on the previous slide about that they derived from the participant statements. So to conclude, I performed a JBI critical appraisal checklist for this qualitative research. And for the first one, I did not identify that there was a philosophical perspective in the study, so I had marked not applicable. While in the second one, I felt that yes, there was some congruity between research methodology and research question, and there's also congruity between research methodology and methods used to collect data. The same thing with research methodology and representation and analysis of data. Um, and again, there's congruity between the methodology and interpretation of results. However, I did not find that there was a statement that the researchers had mentioned anything about their cultural background to the study or to the phenomena. And they did not also identify in the study what their influence were. Um, you know, they did not identify that. Uh, but they did mention that they sought ethical approval from the hospital. That was in the paper, that was in the study. And overall, I felt that the conclusion and the research report did, you know, they were all congruent with analysis and interpretation of data. So overall, um, I would include these studies, even though some of the criteria were not met. I felt that most of them were met, and the researchers did address bias and trustworthiness by performing peer review, audits, and member checking. And these findings were sent back to the participant for validation as well. These are my references, and thank you for your time. Thank you so much for listening. Bye bye.